We're here in Victoria because we are concerned about healthcare in Canada.
There is a clear and concerted agenda to undermine public health care.
The 2014 Accord negotiations going on now are probably the most important negotiations in many decades in this country, because we are either going to use the opportunity to protect, strengthen, and extend public health care in this country, or it could be the beginning of the end of Medicare.
As a Canadian, I'm proud of our healthcare system. I want it to be sustained. I want it to continue on and improve it.
Good evening, everybody. My name is Rachel Tutt, and I'm the co-chair of the BC Health Coalition. We have invited you all here tonight to help raise awareness about the concerns of public health care supporters as the provinces and federal government work to renew the Health Accord and highlight the many positive public solutions available to governments who are truly committed to a sustainable healthcare system. I'd like to start by acknowledging the Esquimalt Nation, whose territory we are on, along with the neighboring Lekwungen and Saanich First Nations. We're very grateful to be here. Now, a little bit about the organizations that are sponsoring tonight's event. The BC Health Coalition is an inclusive and consensus-based network of organizations and individuals that advocates for a universal healthcare system that meets the needs of all British Columbians. The Council of Canadians is Canada's largest citizens organization with members and chapters across the country. They work to protect Canadian independence by promoting progressive policies on fair trade, clean water, energy security, public health care, and other issues of social and economic concern to Canadians. We're here in Victoria because we are concerned about healthcare in Canada. And we see the Council of the Federation meeting that's taking place here in Victoria today and tomorrow as an opportunity for the premiers to work together to renew and strengthen, to invigorate our public health care. But the Council of the Federation meeting also presents an opportunity for us as public health care advocates to have our voices heard. The stated objective of this First Minister's meeting is the tackling of healthcare sustainability. While this is an important goal, we are here to say the evidence is clear. Public healthcare is sustainable. The increases in healthcare spending come from out-of-pocket costs for private health services that are not covered by Medicare. If the premiers are really serious about addressing healthcare sustainability, they must work together over the next 2 days to address the growing out-of-pocket healthcare spending on for-profit services not covered by our public health insurance. The future of public health care has also been called into question in the wake of the federal government's December announcement that it would cut health transfers to the provinces. They buried it very effectively in the pre-Christmas fury, and we really need to be aware that this has happened. This strikes at the very heart of the principles of equality and universality embodied in a healthcare system that the people in Canada overwhelmingly support. We must demand that the federal government remain a full partner at the healthcare table. Healthcare is a joint responsibility, and the provinces need the leadership and coordination of the federal government in order to implement the national standards and programs that we need. I really look forward to hearing what our guest speakers have to say tonight. We have Maude Barlow, Chair of the Council of Canadians. We have Diana Gibson, Research Director of Alberta's Parkland Institute. And we have Mike Luff, Coordinator and Research and Communications for the National Union of Public and General Employees. We're also pleased to have local reporter and investigative journalist Sean Holman acting as our moderator tonight. And from there, I'll hand it over to Sean. Thanks.
Thank you very much, Rachel. I'm privileged to have been invited tonight to moderate this town hall meeting. It goes, I think, without saying that healthcare is an extraordinarily important issue to Canadians. Indeed, poll after poll after poll, year after year after year, has ranked healthcare as among the central concerns of Canadians. Some have actually said that the principle of universal healthcare has actually come to be one of the elements at the core of the Canadian identity. And yet, the discussion about how to preserve that value has unfortunately atrophied at times to simply be sound bites on nightly newscasts and in newspapers, which is why I'm very pleased to see all of you here tonight to participate in a conversation about this topic. So, as such, later on we'll be having a little bit of a Q&A to accompany this town hall meeting, and I would encourage all of you to participate in that question and answer session. It's your opportunity to also have a voice. And to help kick that conversation off, I'm very pleased to introduce our first of three speakers tonight, Mike Luff. Mike is the Coordinator of Research and Communications for the National Union of Public and General Employees, one of Canada's largest unions at NUPG. Mike has coordinated campaigns on many public policy issues, including healthcare, education, and social services. He is currently coordinating a NUPG campaign called All Together Now for Public Services and Tax Fairness. Prior to joining NUPG, Mike worked on Parliament Hill for several members of Parliament and spent some time working in the Federal Leader's Office. He has an undergraduate degree in political science and a master's degree in public administration. He's a very qualified guy. So let's all put our hands together and welcome Mike.
Well, thank you, Sean, and thank you, everyone, for giving me the opportunity to speak tonight. I just wanted to start by saying that on a cold, snowy night like this in Victoria, guest speakers like me feel a lot like a dairy cow. We both appreciate a warm hand, so thank you very much. So, as I was preparing what to say tonight, I read the Premier's news release announcing their meeting, and they said, and I quote, in essence, "We're getting together to agree on key principles to govern a new health accord and the future of healthcare in Canada." Now, they're not asking for my advice. They haven't asked for my advice, although I keep trying to friend request them on Facebook and get turned down. But if they did, I would like to suggest to them 4 key principles to govern a new accord. The first principle, both Rachel and Sean touched on, and that is values. Public Medicare is, first and foremost, about reflecting core values of equality, empathy, and collective responsibility. The great realization of our parents and grandparents was that these values are the very best ones to guide a society. They knew that successful nations are built on these kind of unifying values, not values of self-interest and greed. And they saw public Medicare as a practical expression and application of those values. They knew that without our health, we don't have a chance, and with it, we always do. So they created a system that said, we're all in this together, we're going to take care of each other, and we're going to watch out for each other against all the unending uncertainties in life. So the first principle for a new accord has to be those values, building on those values, not undermining them. The second principle, I think, is economics, smart economics. Public Medicare is the triumph of economics, I suggest, for 3 reasons. It costs less than a private system. Our single-payer system has huge administrative savings compared to the bureaucratic multi-payer system in the US. So it costs us less. But even though it costs less, we get better quality care. Our health outcomes on all major indicators, like life expectancy, infant mortality rate, are way better than the United States and among the best in the world. And thirdly, public Medicare is good for business. It provides businesses in Canada with a competitive advantage and attracts jobs to our country because businesses, employers, don't have to pay for basic health coverage for their workers. Consider the example of General Motors just for a second. Health costs add $1,500 to the price tag of every GM car in the United States. GM spent $5 billion on healthcare in 2009. That's more than it spent on steel. So General Motors is really a healthcare company with an auto division attached to it. So secondly, a new health accord has to be based on this principle of smart economics, which a single-payer system provides. The third principle is innovation. And innovation, if you've read the mainstream media following these discussions taking place, innovation has become a bit of a dirty word. It's become a masquerade, a code word for privatization. But we need to recapture that word because we know that innovation within the public system is happening now, and it's making a big difference. We know the system was built to provide great care for acute illnesses, to be delivered by doctors in hospitals. It wasn't designed to deliver top-notch care for chronic illnesses or the frail elderly or care outside of hospitals. So as a result, there are too many patients in hospitals that should be getting care elsewhere, too many chronic disease patients developing preventable complications, too many people getting illnesses that are preventable. So we do not argue that the system should remain on autopilot, but we do know that the system can be fixed through innovation within it. And there are many excellent examples, from rapid access breast health centers to specialized joint replacement programs to reforming the way drugs are prescribed to multidisciplinary teams working closely together. These innovations have reduced wait times and improved quality. So innovation within the system, not privatization, should be the third principle for a new accord. The fourth principle I wanted to suggest, and then I'll wrap up, Sean, is affordability. The single biggest lie in our political debate today is that public Medicare is not sustainable. The truth is, Medicare is as sustainable as we all want it to be. And I'm going to leave the deeper analysis and numbers to Diana and Maude because they're much smarter than me. But I do want to cover 2 things on this issue. And the first is, it's as sustainable as we want it to be because it's about spending choices and revenue choices. Let's look at the spending choices. It's not credible for Mr. Harper to say the federal government can't afford to invest more in Medicare. There's lots of money in Ottawa. The problem is Mr. Harper spending it on the wrong things. One in 5 Canadians today suffer from a mental health problem. Mr. Harper should choose to negotiate a new health accord that invests in supports and services that take care of those people, not choose to spend $10 billion on US-style mega jails. When you're in an economic recession and people are losing their jobs and they're anxious about their financial situation, Mr. Harper should choose to make their lives more affordable by negotiating a new health accord that includes a pharmacare program that makes their lives more affordable. He shouldn't choose to spend $30 billion on fighter jets we don't need. When many people are working 2 jobs, juggling family responsibilities and trying to look after aging parents, Mr. Harper should choose to negotiate a new health accord that invests in home care and long-term care services that take care of the elderly. He shouldn't choose to spend billions on corporate tax cuts and G20 political slush funds. So, when we hear Mr. Harper say public health care is not sustainable, just remember those are code words for what he really means. He really means he doesn't believe in public health care or its values, and he's got other priorities, like jets, jails, and corporate tax cuts. There's lots of money in Ottawa to build the best healthcare system in the world. The problem isn't healthcare costs, and Diana will talk about that. The problem is that the money's in the wrong hands and Mr. Harper's spending it on the wrong things. Finally, on the fiscal side, on the revenue side, the fiscal challenge for the federal government and most of the provinces is that it's a revenue problem, not a spending problem. Mr. Harper claims the deficit is a huge problem and that government spending is out of control. But if you actually cared to look at the numbers instead of just making things up, he would tell you, he would know and he would say, there is no deficit crisis at the federal level in Canada. We're in the best shape of the entire G8 by far. It's not even close. The federal deficit today is just over 30% of our gross domestic product. In most of the other G8 countries, it's approaching 100%. When we hit the so-called debt wall under the Mulroney government, the deficit was at 70%. We are in good fiscal shape. The deficit will come down over time as the economy recovers. At the same time, when you look at total government spending, not just healthcare, but total spending, governments in Canada today spend way less than we did in 1992. It has been decreasing year after year. So as our economic pie got bigger, the slice going to public spending has been getting smaller. It was 53% in 1992, it was 39% in 2008. So there's not a deficit problem or a spending problem, but there is a revenue problem. Since the mid-90s, governments in Canada, municipal, provincial, and federal, have spent billions on tax cuts. They've spent $90 billion on tax cuts every year. That's not a cumulative figure. That's how much revenue they have given up every year. Mr. Harper says the deficit's the problem, but on January 1st of this year, he passed another corporate tax cut. Dalton McGuinty says that the deficit's a problem in Ontario, but he's passing another corporate tax cut on July 1st, getting mad, on July 1st. You know, my grandfather gave me a piece of advice when I was young. He said, Mike, when you're in a hole, the first rule is you stop digging. Apparently, Mr. Harper and Mr. McGuinty and others have never heard that. So the truth is, as I wrap up, if governments weren't spending so much on tax cuts, we wouldn't have deficits today. And on top of that, we could afford to expand Medicare to include new programs for home care, long-term care, pharmacare, and mental health services. This is a critical part of the battle for us. Medicare's opponents know they can't win the battle of values, or the battle of economics, or the battle of innovation. They know the only way to get rid of Medicare is to not give governments any money in the first place. That's why we've heard so much propaganda about tax cuts for the last 15 years. So the fourth principle for a new health accord is the recognition that Medicare is as sustainable as we want it to be. It's all about choices on the spending side and choices on the revenue side. So those are my four principles: values, economics, innovation, affordability, and I thank you for the chance to be here tonight.
Thanks, Mike. And now I'd like to introduce the next speaker, Diana Gibson. Diana is the research director of the Parkland Institute, a social policy research center based at the University of Alberta. She has conducted research and worked nationally and internationally on topics ranging from free trade to energy policy to healthcare to education. She is the lead author of the book, The Bottom Line, The Truth Behind Private Health Insurance, as well as numerous other reports on healthcare policy. Diana?
Hi, everybody. Thank you so much for coming out. I'm not going to do half of the things that Mike promised you I'd do, as Diana will say. I want to start with, and I'm not going to refer to any dairy cow metaphors. I want to refer back first to the digging of a hole reference that Mike made and say that, as he mentioned at the end of his talk, that this is an intentional strategy to undermine government and undermine public programs. And I once, when I was doing a speech, channeled Grover Norquist. Anybody here know who he is? I just like the name Grover. He was a key advisor to the Bush administration, and he had this great epiphany early on. He's a very sort of big right-wing backroom guy. The idea that the more they shrink government, the more room there is for private sector profits and corporations. And given that there aren't that many new frontiers for corporations to go out and take over, the public sector is one of the biggest frontiers left. We've got a great lucrative market ready for private investment. So he had this great idea. Let's shrink the size of government. And then, and his famous quote is that he wanted to get government small enough that you could drown it in a bathtub. So, and you ask, why would she want to channel him? And then he had to think about, how do you do it? How do you get government small enough to drown it in a bathtub? And his epiphany after that was, starve the beast. And the way you starve the government is to eliminate taxes. You demonize taxes. So then after that, they created this right-wing book of special sayings, and one of them is tax burden. Never say tax without saying burden. Taxes are always a burden. And demonized taxes and demonized government very successfully. And that is why the Harper government, despite saying we're in a fiscal crisis, we can't afford core public programs like public health care, is still cutting taxes. And, you know, they use these justifications like, well, it's going to create jobs and economic growth. And if you look at the evidence, of course, it's not borne out in the evidence at all. And it's actually not rocket science to figure out why. Because if the government taxes a corporation or a wealthy individual and puts that money into program spending like healthcare and education, they're hiring teachers, nurses, doctors, health professionals, care aides, physiotherapists, chiros, they used to. And those people live and work in the local communities where they spend most, if not all, of their salary on local services, which employ other people locally who spend all of their salary on local services. If you took that same money and you gave it to a corporation or a wealthy individual, they are just as likely to take it to Hawaii and spend it on their condo. They are. They're right now because it's cold here. So it's not surprising that if you look at the data, the evidence doesn't bear out that tax cuts create jobs. Direct spending on healthcare and education, if you look at the government's own multipliers, give you better bang for your buck in terms of job creation and economic growth for any dollar spent. Healthcare and education, you get more jobs and more economic growth than if you give it away as a tax cut. So it's a no-brainer. It's a great investment, and it's a good way to stimulate our economy. And I was debating a guy from the Canadian Taxpayers Federation, Scott Hennig, and when I was debating him, every time he opened his mouth, all I had to say was, yeah, but Norway. Yeah, but Norway. Because Norway entered the recession later than almost every other OECD country. They had the shallowest dip, and they came out the soonest. And they had the highest consumer confidence in the OECD. And Norway has a bigger public sector. And it's not in spite of their big public sector, it's because of it. And they invest in programs like a continuum of care for seniors that's public and affordable, accessible. So there is a clear and concerted agenda to undermine public health care. And I thank you all for coming out tonight, because in December, when Flaherty announced that they were unilaterally in a take it or leave it dictate from the federal government, telling the provinces, take it or leave it, here's what you get, and that it was going to be eliminating core tenets of what we value in healthcare, that really represented the Harper government's intention to undermine this program. And that's what he did in that December announcement. It included a few really big changes in direction. One, of course, that it was dictated. It wasn't the federal government negotiating. It was the federal government giving an edict to the provinces. So that really shows a different relationship of us as a nation. It's tying our spending now for healthcare to economic growth after 2016, instead of to drivers of healthcare costs, like new technologies, if they come on, that citizens want and are willing to pay for with their tax dollars. Or aging, which is, though not going to cripple this system, is going to cost some money. Or population growth or inflation. No, he's tying it randomly and unilaterally to economic growth. And those of us from Alberta, I know BC has some boom-bust scenarios, but not like us in Alberta. We ride that roller coaster really rough, all the way up and all the way down. We know what economic growth looks like. It's booms and busts. And if we tie our healthcare spending to economic growth, it's going to look awful. It's not a practical way to plan long-term spending for critical social programs. The other thing that announcement was included is a move away from equalization. And that's where the federal government used the health transfers to even out the healthcare revenues across the provinces, so that all provinces had an equal amount of health, so that they could offer equal levels of service. And this is one of the core values that we see this federal government abandoning: universality, equity, and taking care of each other. Wealthy provinces like Alberta, and I have to admit, I'm ashamed. I'm often ashamed of my province, of the Tory government, especially around energy policy, but now on healthcare policy. They're willing to back the federal government's winner-takes-all cash grab for Alberta, because we don't have enough with the oil and gas wealth that we refuse to share well across the country. We're going to cash grab from places like Nova Scotia and Ontario, our new have-not province. So the change that's showing up in this new formulation by the federal government is that we're not going to have the wealthier provinces share with the less well-off. We're not going to take care of each other. Harper is trying to rewrite this nation in the image of the United States, and I mean, really, look where that's got them. So it's a meaner-spirited country that he wants us to have, where we don't take care of the less well-off, blame the poor, and the wealthy don't have acknowledgement of their privilege but feel it's their right. And wealthier provinces feel it's their right to cash grab from the less wealthy. It's redrawing the map of what we value as a nation. And so that's why I'm very glad you've all come out tonight to participate in this forum, because this is about more than healthcare. This is about who we are as Canadians, and Sean mentioned that. It's about a nation where we care about taking care of each other, sharing. I mean, we've learned that in every part of this country. We've had to take care of each other to keep this country going and keep our communities going forward. And healthcare is just one piece of how we share and take care of each other. And it's how we pool our resources to buy programs together, instead of being out there one-off in the market where we get taken advantage of. Anybody here knows you try and negotiate one-off with your employer as compared to negotiating as a group, you're not going to do as well. And that's why people shop at Costco, because bulk purchasing is cheaper. In fact, I'll end with a great quote for you from Calgary, the famous surgery center in Calgary that went bankrupt. They were actually charging more per surgery than the public system was paying. They were charging, so it was very expensive to do those surgeries in that center. It was privatization isn't some magic bullet that'll save us money. But anyway, so when they went bankrupt, before that, they had put a submission in to the Alberta Health Act debates that said, the public system benefits from economies of scale and bulk purchase that's unfair. And they did. And they said in the new Health Act, Alberta had to make sure there was a, and I quote them, this is from the Calgary Chamber of Commerce, on behalf of private surgeries, a quote, leveling of the playing field. For those poor for-profit surgeries that didn't benefit from the economies of scale and bulk purchase deals that the public sector got. The public sector, Medicare and public delivery is a bargain. It's cheaper, delivers better quality, and private for-profit is not the answer, it's the problem. Thank you.
And now I'd like to introduce our next and final speaker, Maude Barlow. Maude is the national chairperson of the Council of Canadians and chairs the board of Food and Water Watch, a Washington-based organization. She is founding member of the San Francisco-based International Forum on Globalization and a counselor with the Hamburg-based World Future Council. She's getting around all sorts of places. Maude is the recipient of 11 honorary doctorates as well as many awards, including the 2005 Right Livelihood Award, which is known as the Alternative Nobel. In 2008 and 2009, she served as senior advisor on water to the 63rd President of the United Nations General Assembly and was a leader the campaign to have water recognized as a human right by the UN. She is also the author of dozens of reports as well as 16 books, including the international bestseller Blue Covenant, The Global Water Crisis, and the Coming Battle for the Right to Water. In other words, I didn't really need to introduce her. Maude Barlow.
Wow. Thank you very, very much for a gorgeous introduction. Sean, thank you, Rachel, and the coalition here, all of you guys who've done such a wonderful job here tonight. Diana and Mike, an honor to be on this podium with you. I am thrilled to see this big crowd here today because we're told that Canadians aren't interested in such things. So I keep saying to my mainstream media, I won't call them friends, perhaps, just people I'm trying to bug into coming to things like this. You should come out to an evening like this. You might be surprised at who's here, but anyway, I'm just delighted to be here. So as you know, the health ministers and the premiers, of course, are gathered here for the most important negotiation, I would argue, on healthcare in perhaps since the 1960s. And that's because there are a set of threats to our healthcare that haven't existed in decades, and it's really an ideological struggle, as my colleagues have talked about tonight. And it's part of an international assault on the very notion of government, from deregulation to privatization, and of course, free trade. And Diane and I just laughed. I showed her, I had a Grover Norquist quote about the bathtub coming up next. But it is a great image that he said the ideal size for government was small enough to put in a bathtub so you could pull the plug when it was time. After 30 years of liberal market fundamentalism, we are seeing a set of deliberate policy choices and the transfer of wealth and power to corporations and a superclass. And I would say that this is an extremely organized undertaking. The 3 richest men in the world have more money than the poorest 48 countries combined. While 1.5 billion people in the world, that's half the global workforce, are unemployed or live working in precarious working conditions, governments are shutting down social programs, environmental protections, and of course public services such as healthcare. We know the story in the United States. There are now 52 million people officially without healthcare insurance. Naomi Klein calls this the great sacking and says that they have the nerve to think that it's such a good thing that they do it with all the lights on, because this is just the sense of entitlement of this class. And I like to think of our leaders, our political and academic and corporate leaders, as forming a kind of global royalty in which they kind of have more in common with each other than they do with the people of their countries. And I think our world is more broken by class now than by geography than ever before. I love my favorite Occupy sign, I think caught this the best. It said, "If you won't let me dream, I won't let you sleep." And you wait till the spring. Occupy is coming back, and it's coming back with a vengeance. Now, Canada has undergone the same process, and the only reason our finances aren't as big, and I just want to take a minute to boast a little bit about the fact that back in the late 1990s, the government, Liberal government, tried to deregulate or intended to deregulate the banking system, and I remember our organization led a big fight against this, and now not only does Jean Chrétien take total credit for saving the economy, but even Stephen Harper claims it, and I think, give it a rest. It was a citizens movement and a fight with us and the labor movement and other groups in Canada that stopped them from doing this. So there. Nevertheless, as you'll remember, some of you, Brian Mulroney, when he came to power, saying, "Give me 20 years and you won't recognize this country." And in fact, he was right. And we have moved demographically from looking like a large egg with a large middle class to looking more like a pear, with fewer and fewer of us holding power and financial security at the top, and more of us falling out of the bottom. And of course, more and more of us one paycheck away from welfare. The top 5% now take home 40% of the income, while the bottom fifth are left with just 7% of the pie. That's in Canada, that is still relatively equal if we compare ourselves to the United States, but quickly changing shape. Now, I think we have to say it to each other and ourselves, and that is that Stephen Harper is the most right-wing prime minister we have ever had in this country, and in my opinion, he's dangerous. This is a man who is not only a neoliberal financially and economically, but a neoconservative socially and politically, and that's a very dangerous combination. Brian Mulroney was not neoconservative in the social sense, in that sense. So we have a very dangerous combination. And he is absolutely determined and clear about what his agenda is. He's of course, going to be overseeing this whole process with the renegotiation of the healthcare accord. And so we need to stop and remember who he is and what he's about. He is absolutely ruthlessly cutting any opposition. Most recently, he cut funds to the Canadian Environmental Network, but you name the group that may not even have criticized or critiqued, but may have some ability to do so in the future. Their funding is gone, and I am so grateful that my organization, the Council of Canadians, never took 1 cent from government. Not that they'd ever have given it to us, but you know, in fact, we can't even get charitable tax status, and what seemed like such a struggle for so many years now is a blessing, because we had to learn to do without it. But we're watching one group after another go down because they simply have had the funding totally cut. He's closed committee hearings. Speak to NDP members of Parliament, and they will tell you that they're being told in committee meetings that they're not. That these are now closed, and they're not allowed to say if they have how they voted on something or what was said. Slashing Environment Canada. We're not even allowed to know the names of the scientists that are being so-called downsized. And of course, you know the appalling position that our country took on Kyoto. You know, leading countries like China and France to actually come out and publicly, you know, scold Canada for this terrible position. We've killed the wheat board. Absolutely, this is one of the most important traditions, the most important institutions in our country that stop the major American grain companies from coming in and taking over that sector, that brought money and revenue back into communities. It brought a decent
recent return to the farm gate. This was a marketing board that was both as exactly the same description that my colleagues have said about healthcare, good economically, but good in terms of social justice. So of course it has to go. Forcing municipalities to turn to private water companies if they need federal funding for new water infrastructure. But yay to the people of Abbotsford who have the courage to say no to $67 million of Harper's money. Stephen Harper is even promising bonuses to senior government bureaucrats depending on how many people they fire in this downsizing. He's actually giving bonuses based on the number of people that they let go. That is no way to make a decision about who should be let go in a downsizing. And now they're negotiating a new bad trade agreement called CETA, the Comprehensive Economic and Trade Agreement with Europe. And when you think about Europe, you may think, well, Europe has got better environmental standards, better labor standards. Put that image away. That's an old image of Europe. Europe is going through massive privatization, massive deregulation. They've signed a procurement agreement with one another in which they are allowing each other's corporations to cross their borders and be treated as domestic industry, and in turn are privatizing the public service to give them opportunity. It is a dangerous agreement to every public service, to every local rule, to local food programs, to public health in every way. And this government is just plowing ahead with it. And unfortunately, it seems all of the provinces, including ones that should be more friendly to us, are going along with it. And we know that we're going to see the cost of drugs rise to close to $3 billion a year in Canada if CETA is signed, because Canada is agreeing to adapt our patent regime to the European pharmaceutical regime. This is a government that says it doesn't have money for health care, and yet it's got money to spend $3 billion on drugs. Well, I guess it's us that's going to be spending it, so they don't care about that. Remember that Stephen Harper, once led the National Citizens Coalition, which was founded to fight public health care. The founder, Colin Brown, was a life insurance salesman. He was a wealthy life insurance salesman, and he said that public health care in Canada would kill millions of Canadians. That was his quote. Stephen Harper is on record many times as saying he believes that health care should be turned over to the provinces in terms of financial responsibility. And of course, he's allowed the privatization of health care services in many provinces, and leading in many ways to the death by 1,000 cuts. So we need to be very conscious as we're entering this process, and as these premiers are meeting over downtown in that hotel, that this is the backdrop to what he and several provinces have in mind. They are basically using this occasion to set about the total renegotiation of health care in this country, and we're going to find ourselves moving steadily backwards. As Diana said, he knows that he can't do this through the front door, like he destroyed the wheat board. He just said, I don't care what you think, it doesn't matter if it's illegal, it doesn't matter if it violates the law, and we are joined with other groups to take that to court. But he said, I don't care, I'll just change the legislation if needed. And so what they've done is they basically pulled the rug out on this financing, which is going to cost the provinces about $31 billion in lost federal revenues over the duration of the accord. And the Parliamentary Budget Office says that with the cuts that they have announced, unless something changes, and the next election is a good chance to do that, that the federal share of healthcare funding, which is now 20%, will fall to 13% over the next 2 decades, and steadily below that in the future. Now, this is a brilliant strategy for a man determined to kill public health care in Canada, because he doesn't have to do the deed himself. He could just turn it over to the provinces and let them do the dirty work. If they're eager to do that, then they're going to enter into a private system immediately. Others will take more time to do that. What we're going to end up with is a patchwork of services, many of them privatized, and of course the end of a national dream of health care.
And the promise at the heart of Medicare, and that promise is that you can go to any province in Canada and know that you'll get the same quality of service and you have the same right to this service, will be gone. And the jewel in our crown, of our Social Security crown, will be gone, perhaps forever. So we have a huge fight on our hands, and it's a recurring theme. I think every generation has to come back and fight for these programs and for health care, but I think it's a particularly crucial and critical one at this moment. And so I think it's important that we not be reactionary, but rather that we start talking about our narrative, and we talk about a narrative that will replace the narrative that they're putting out, which of course is that our healthcare system is not sustainable. As Mike said, it is extremely sustainable. Public costs as a percentage of our GDP have remained remarkably steady over the last decades. The issue has been rising drug costs and rising private services. And so we have to say that Canadians need universal, comprehensive health care from the cradle to the grave. That the 2014 Accord must not only not be weakened, but must protect, strengthen, and extend Medicare. We must hold firm, to a new full 10-year accord with escalating transfers of 6% for the duration. We need a commitment to enforce the Canada Health Act, no user fees, no private services, no extra billing, and we must put the case to the Canadian people for a national pharmacare strategy. The 2004 Accord was supposed to deliver a program to bring catastrophic drug coverage to Canadians, but it never materialized. A national pharmacare system would save governments over $10 billion a year by bulk buying prescriptions across the country. And we need a plan for continuing care. Lack of care for seniors and home care is a growing crisis. A real national program will provide alternatives that are both less costly and more humane than hospitalization for seniors. And without a full federal, provincial, territorial accord, will the funding for First Nations fall between the cracks? Healthcare on Aboriginal communities in Canada is still often shockingly substandard. The 2014 Accord must deal with this injustice. And finally, we need to make a firm commitment to take healthcare out of trade agreements and not allow healthcare to be placed into any future trade agreements. And you should know that the trade agreement with Europe, the CETA that I talked about, has the same provisions for corporations to sue governments, but this time governments of all level in Canada, if any of them change their minds after privatizing, allowing competition, and then saying that was a mistake. Every generation has had to fight for Medicare, and we owe it to those who came before us and those who will come after us not to let it go on our watch. Healthcare is a fundamental right and a public good for which no financial barriers must be erected. Canadians have fought for this right, and it cannot be taken away from us on an ideological whim. We need a full commitment from the federal government to assume its historic responsibility in setting national standards that guarantee universal, comprehensive coverage to all Canadians. Nothing less than this will do. These are our rights and demands. And no one, not even Stephen Harper, has the right to unilaterally destroy our healthcare system. He should remember He should remember, and we should remind him, that if you take the people who did not vote for him and the people who did not vote for at all in the last federal election, only 25% of Canadians elected Stephen Harper. And yet, because of our system, which is flawed and we all know it, we have this situation of his false majority. So we need to remember and take heart from the original fight for Medicare, which was ferocious. People lost their homes and their farms to pay for health care. When they moved from one province to another, they often had to live there for a year before they could apply for any kind of insurance. Half the young men called up for service in 1939 were rejected because of poor health care. Can you imagine such a thing in today's world? Life Before Medicare is a book that was put out by a group of seniors in Ontario, and they tell stories of what health care, a lack of health care, was like in the years before Medicare. One remembers a young mother dying on the steps of a hospital in Grand Prairie while her husband was outside begging for them to take her in. Another remembers a young Ontario mother who had to sell her 2 cows to pay for the hospital so her dead baby's body could be released to her, and they would not release the child until she could find the money. A Manitoba senior recalls a neighboring farm woman who was diagnosed with cancer. She knew that in order to get treatment in hospital, her family would have to sell the family farm, so she decided to die at home. When her husband went out to work in the fields, she had him close all the windows so the neighbors wouldn't hear her cries of pain, and lock the doors from the outside to stop them running for help. Her suffering lasted for 2 months, but she saved the family farm. When Tommy Douglas decided to bring in public insurance in Saskatchewan, he faced the private insurance industry, the Canadian Medical Association, the American Medical Association, and the Saskatchewan College of Physicians and Surgeons, who went on strike. To meet the healthcare needs of the people, a coalition of farmers, unions, and healthcare workers set up 27 healthcare cooperatives that still exist in Saskatchewan to this day. They brought in doctors from Great Britain, including 2 women doctors. Dr. Joan Whitney and Dr. Margaret Maude had to be escorted to work because they received regular death threats. The strike was reported all over the world. Of Tommy Douglas, the Vancouver Sun said, "This man, Tommy Douglas, is, well, a good deed in a naughty world. He is a breath of clear prairie air in a stifling climate of payola and chicanery and double talk and pretense." Medicare is our way of sharing for survival. Our ancestors came here, they found a harsh geography, they settled mostly along that Canada-US border, and we knew that if we didn't share with one another and create ribbons of interdependence, that we would not exist. And that's what the CBC was. Graham Spry, the father of the CBC, used to say the state or the United States to describe why we had to have a national broadcasting system. At that time, it was just radio. But we built ribbons of railways and an airline and a public broadcasting system, and supported public Canadian publishers. And the last one, McClellan and Stewart, has just gone down, taken by a big company called Random House, which is in turn owned by Bertelsmann from Germany. So back to my CETA concerns, right? But these ribbons of interdependence included our social programs, and we have seen them eaten away or destroyed completely, one after another. And I remember when the first free trade agreement was ratified and we started documenting, this is pre-NAFTA, I kept saying to people, somebody should be writing a book about this. This is just a terrible story. Look what's happening to our energy. We've lost control. Look what's happening to our social programs. I started documenting, and I said to a friend, I even know what it's going to be called, or somebody should write a book that's called A Parcel of Rogues, after Rabbie Burns's poem about the people in Scotland who sold Scotland out. And the poem goes, British steel we could disdain, but British gold has been our bane. What a parcel of rogues in a nation. So the rogues were the people in Scotland who sold that country out. So I even thought, somebody has to write this book. And people said, Maude, I think maybe you'll have to do that. And I said, yeah, but I don't write, and I don't know how to type, and I don't have a computer. And so sat down and poked it out, and the rest was history. But I remember just following the job losses and the change that Brian Mulroney had promised to us, and indeed they have happened. And now we have this Prime Minister coming along and saying, what wasn't finished in that first wave, I'm going to finish now. And we have got to stand up and say no. We have got to stand up and say, we're not patient, we're not going to wait for the next election. We're going to be out on the streets with the occupiers. We're going to be in your face everywhere you go. We are going to say to these premiers, this is not acceptable. You cannot take our healthcare system. It doesn't belong to you. So let us bring some clear Vancouver Island air to this struggle, like Tommy Douglas's clear prairie air, and tell these negotiators and these premiers that the Canadian people fought long and hard for our public healthcare system, and we are not about to give it up. And let us vow tonight to stand on guard for it, lest it be destroyed by stealth,
and lost in a myriad of betrayals. We owe this to those who fought for generations before us, and we owe it to those who come after us, who have the very same right to public health care that we do. Thank you so much.
The 2014 Health Accord. It's our Medicare system. Have your say. Get involved. Contact Canadians.org or BCHealthCoalition.ca.